What if the solution for confronting the most hazardous form of fat in your system wasn't a novel diet fad or an exhausting workout plan, but rather an uncomplicated, natural beverage consumed immediately before you retire for the evening? I am referring to a precise method for targeting the fat that remains invisible to you. This is not the soft, superficial fat you can grasp between your fingers. This is visceral fat, the concealed fat that entwines itself firmly around your essential internal organs, your liver, your pancreas, your intestines. The significance of this cannot be overstated because this fat is not passive. It functions as a living, metabolically active tissue. Around the clock, it operates like a manufacturing plant, continuously releasing inflammatory agents and hormonal signals into your system. This inflammatory response is the direct route to the very ailments I address daily in my senior patients: type 2 diabetes, hypertension, heart attacks, strokes, and hepatic steatosis. Many individuals are familiar with green tea for weight management, and it does offer certain advantages. However, on this occasion, I will present 7 additional natural, potent teas. These particular infusions are scientifically demonstrated to bolster your body's innate fat burning and restorative cycles, which reach their peak activity while you are asleep. We will examine each one, their mechanisms of action, and the proper methods for their preparation. You will want to remain for all 7. As we proceed through this vital information, if you find it helpful, please consider liking this video and sharing it with any friends or relatives who might gain from this understanding. If you are a new visitor to this channel, I encourage you to subscribe for additional pragmatic, scientifically grounded health guidance. Furthermore, I am sincerely interested to know, from which city or nation are you viewing this today? Please share that with me in the comment section below. It is continually inspiring to witness the vast distances this health message can travel. Now, let us commence. The first pairing I wish to address is arguably among the most potent. It is turmeric tea, enhanced with black pepper. This is a warming, golden-hued beverage, yet its therapeutic value is immense. The principal active component within turmeric is known as curcumin. You have undoubtedly encountered the term inflammation on numerous occasions. Within my specialty of geriatrics, we frequently discuss inflammaging. This describes the persistent, low-grade, systemic inflammation that accumulates silently as we grow older. It is the simmering, unnoticed blaze underpinning a multitude of age-associated disorders, from arthritic discomfort and joint stiffness to the onset of cardiovascular disease and even cognitive deterioration. This inflammaging also generates a biological setting where your body finds it exceptionally easy to accumulate fat, particularly this perilous visceral fat, and makes it exceedingly challenging to shed. When you consume turmeric tea approximately 1 hour before bed, you are introducing a powerful anti-inflammatory substance right at the start of your body's natural, nocturnal restoration cycle. This is the period when your system is most prepared to heal. However, as was accurately highlighted, there is a vital particularity. Your body is remarkably inefficient at absorbing curcumin in isolation. It is a substantial, complex molecule that our intestines struggle to transfer into the circulation. This is the point where black pepper becomes indispensable. Black pepper incorporates a component named piperin. This substance functions as a biological key, unlocking curcumin's potential and boosting its absorption into your bloodstream by as much as 2,000%. Without it, the advantage is, to be frank, mostly forfeited. This combination also sustains your liver's detoxification rates and, very significantly, aids in enhancing insulin sensitivity. This implies your cells become more responsive to the hormone insulin, enabling your body to utilize sugar for energy effectively rather than promptly storing it as adipose tissue. The outcome is not merely a slow, progressive decrease in abdominal fat, but many of my patients also describe waking up with markedly less joint stiffness and reduced abdominal distension. For its preparation, simply incorporate 1 teaspoon of turmeric powder along with a very small pinch of black pepper into a cup of freshly boiled water. Allow it to simmer lightly over low heat for roughly 3 minutes, strain the mixture, and consume it while it is still warm. I must include an essential medical advisory: curcumin has a mild blood thinning effect. If you are presently using any anticoagulant drugs, like warfarin, Eliquis, Xarelto, or even a daily aspirin therapy, you absolutely must consult your doctor before adopting this as a regular practice. The second tea I want to talk about is hibiscus. This is a stunning, deep crimson infusion possessing a agreeable, tangy flavor reminiscent of cranberry. Its potency originates from its high density of bioactive elements termed anthocyanins. These are the identical powerful antioxidants present in dark berries such as blueberries and blackberries. It was mentioned that these compounds produce a thermogenic outcome. Let us be perfectly clear on the meaning here. It is not an inferno. It will not mystically dissolve fat as you sleep. Instead, it offers a very mild, subtle boost to your metabolism, prompting it to stay active and efficient even while your body is winding down for rest. For an older individual, whose basal metabolic rate has naturally decreased with age, this gentle, persistent support can be quite impactful over the long term. Certain scientific investigations have indeed demonstrated a connection between regular hibiscus intake and a decrease in waist measurement. Yet, from my clinical viewpoint, I am even more captivated by its other, more thoroughly recorded advantages. Hibiscus tea has been revealed in multiple, high-caliber clinical studies to exert a measurable, beneficial impact on blood pressure. Hypertension or elevated blood pressure is arguably the most prevalent chronic condition I treat in my patient population. Hibiscus seems to operate as a natural, mild ACE inhibitor, which assists in relaxing vascular walls and as a result lowers pressure. It also possesses a mild diuretic property, aiding your body in gently excreting surplus sodium and water. This is the reason many people report feeling considerably less bloated in the morning. This is not fat loss occurring overnight, it is the alleviation of fluid retention which contributes to that burdensome, uncomfortable sensation and can frequently obscure the progress you are achieving. To prepare it, immerse 2 tablespoons of dried hibiscus flowers in 1 cup of boiling water for about 10 minutes. This permits those anthocyanins to be completely extracted. Strain it, and I suggest drinking it roughly 2 hours before going to sleep. This timing is crucial. Because it acts as a diuretic, you need to allow your body adequate time to process it before you enter a deep sleep to prevent disturbing your rest. And once more, a necessary warning. Due to its blood pressure lowering capability, if you are already on antihypertensive drugs, you must observe your blood pressure carefully and talk about this with your physician. It can intensify the effect of your medication, and it may also interact with specific prescription diuretics. Now, while controlling inflammation and fluid retention is vital, we need to tackle another main contributor to abdominal fat, especially in the elderly demographic: chronic stress. This leads us to our third tea, which might astonish you: sage. Most individuals recognize sage as a culinary herb, something utilized for a festive dinner. However, when prepared as a medicinal tea, it unveils remarkable qualities for managing stress-induced weight gain. The secret is found in its natural constituents, such as rosmarinic acid. These components appear to exert a direct impact on the regulation of cortisol. Cortisol is your main stress hormone. It is a critical survival mechanism if you are confronting an immediate physical danger. The issue is that, in our contemporary existence, the stress is typically not a physical peril, it is persistent low-grade worry. For my older patients, this could be anxiety about health, financial matters, family, or it might be a simple physiological stressor, like the inadequate, broken sleep that often comes with aging. This results in chronically high cortisol levels, particularly at night when they should be at their absolute minimum. When cortisol is elevated at night, it transmits a powerful biological message to your body. Why are in a state of danger? Store energy right now. And its preferred location for storing that energy is deep within your abdominal cavity, as visceral fat. This is a survival instinct that has become profoundly misguided. Drinking sage tea in the evening can assist in modulating this. It exerts a soothing influence on the nervous system, which subsequently helps to normalize that evening cortisol level. It aids in transitioning your body out of high alert and into rest and recovery mode. This is the exclusive state in which your body can efficiently repair itself and utilize stored fat. Without this hormonal transition, fat burning is biologically extremely challenging. The preparation is simple. Use 1 tablespoon of dried sage leaves in 1 cup of hot water. As was correctly noted, take care not to employ water at a violent boil. Extreme heat can impair some of these sensitive compounds. Let the infusion steep for approximately 8 minutes. Strain it and drink it while warm, ideally about 40 minutes before bedtime. In addition to assisting with cortisol regulation, it enhances your sleep quality, which, as we have established, creates a positive cycle for improved metabolic health. A straightforward caution for people who already have inherently low blood pressure. Sage tea can produce a mild hypotensive impact, so it should be used sparingly. The 4th tea on our list is a genuine classic, a synergistic partnership, ginger and lemon. This combination functions in perfect harmony, and its benefits are both instantaneous and enduring. Let us analyze this from a clinical standpoint. Ginger contains potent bioactive substances, specifically gingerols and shogols. These are responsible for ginger's faintly spicy, warming flavor. It was mentioned that this is thermogenic, and again, this indicates a mild, supportive elevation in your metabolic rate. It is akin to gently stoking your body's internal engine. However, from my medical perspective, I am considerably more impressed with ginger's profound anti-inflammatory and, most notably, digestive characteristics. This is where it truly excels for my senior patients. As we age, our entire digestive tract naturally becomes slower. We generate less gastric acid, and our digestive motility, the pace at which food travels through our system, becomes more lethargic. This is the reason indigestion, abdominal fullness, reflux, and bloating are among the most frequent complaints I encounter. Ginger is what we classify as a prokinetic agent. It mildly stimulates the gastrointestinal tract, encouraging it to propel food along effectively. A calm, comfortable, and efficient gut is the absolute cornerstone for a healthy metabolism. If your digestion is stagnant, your entire system becomes sluggish. Now, let us consider the lemon. It contributes more than a refreshing citrus taste. It supplies vitamin C, a crucial antioxidant, but more significantly, it provides pectin. Pectin is a form of soluble fiber. This fiber is especially important at night because it helps to decelerate the absorption of any sugars from your evening meal that remain in your digestive tract. This action prevents a sharp blood sugar surge. When your blood sugar surges, your pancreas discharges a flood of insulin to handle it. Insulin is a storage hormone. Its function is to remove excess sugar from the blood and store it, principally as fat. By stabilizing your blood sugar, the pectin in lemon helps to avert this insulin spike, maintaining your body in a more neutral or even fat-burning condition as you rest. This is a simple yet powerful method to manage your nighttime insulin response. Preparing this tea is uncomplicated. Peel and thinly slice approximately 2 centimeters of fresh ginger root. Boil it in 1 cup of water for around 5 minutes. Once you remove it from the heat, incorporate the juice of half a freshly squeezed lemon. Permit it to cool until it is comfortably warm. This is an excellent tea to consume about 1 hour before bed. A practical note for those who experience severe acid reflux or GRD, both ginger and lemon can be aggravating to the esophagus. If you have this condition, you must begin with a very weak, diluted infusion to assess how your body responds. We have covered inflammation, stress, and digestion. Now we must direct our focus to one of the body's most critical and often most overwhelmed systems in the battle against visceral fat, the detoxification pathways. This brings us to our 5th tea, horsetail. This is an ancient medicinal plant, and while many know it as a treatment for skin, hair, or nails, few recognize its value for countering this deep abdominal fat. What renders horsetail distinctive is its unique and dense mineral composition, particularly its abundance of silicon and potassium. Silicon or silica is a trace mineral that is absolutely essential for constructing and sustaining healthy connective tissue. That means your bones, your cartilage, your skin, and your arteries. For my geriatric patients, supporting bone density and joint health is a primary focus, so this is a significant additional benefit. But within the context of visceral fat, horsetail's power stems from its support of your body's innate cleansing processes. As we grow older, the efficiency of our liver and kidneys naturally diminishes. The detox pathways can become slow. Your liver is already laboring intensively at night to neutralize toxins. Horsetail supports the subsequent step, elimination. Visceral fat is not clean fat. It is a recognized reservoir for metabolic waste and environmental toxins that your body has isolated. Horsetail's mineral content, particularly its potassium, supports renal function. It acts as a natural diuretic. It gently encourages the removal of excess fluids and the toxins dissolved within them. This is why it is so effective at diminishing abdominal bloating. By flushing this surplus fluid, it not only helps you feel lighter, but also prevents unnecessary strain on your circulation. However, I must be very firm and explicit with my warning here. Horsetail is a powerful diuretic. It is not a mild, daily tea like ginger or hibiscus. Because it is so effective at expelling fluids, it can also deplete your body of potassium. This can be hazardous, particularly if you are on certain blood pressure medications, cardiac medications like digoxin, or prescription diuretics like furosemide. If you have any history of kidney problems, kidney stones, or renal disease, you must not use this tea without the direct supervision of your healthcare provider. For a healthy person, it can be an effective instrument when used in moderation, perhaps for a few days consecutively, but it should be rotated with other teas and not used continuously. To prepare it, use 1 tablespoon of dried horsetail in a cup of boiling water. Allow it to steep for about 12 minutes, strain thoroughly, and drink it approximately 2 hours before bedtime. This timing is important, as with hibiscus, to allow its diuretic effect to subside before you enter a deep sleep. The 6th tea that warrants a place in your nightly regimen is cinnamon. This is a spice most of us associate with sweet fragrances and seasonal baking, but medicinally, it is one of the most powerful instruments we possess for managing blood sugar and, consequently, visceral fat. What makes cinnamon exceptional are its bioactive compounds, especially cinnamaldehyde. This compound has been shown in numerous studies to have a direct, positive influence on how your body manages glucose. The central issue for many, if not most, adults as they age is a condition termed insulin resistance. You can conceptualize it in this manner for years. A diet high in processed foods and sugars has caused your blood sugar to spike repeatedly. This compels your pancreas to shout by releasing deluges of insulin. Over time, your cells, your muscles, your liver become numb or resistant to this constant shouting. They stop listening. So your pancreas has to shout even louder, generating more and more insulin to accomplish the same task. This state of high insulin, or hyperinsulinemia, is the very definition of a fat storage mode. It is also the direct forerunner to type 2 diabetes. Cinnamon appears to assist in resensitizing your cells. It makes them listen to insulin's signal once more. It helps transport glucose from the blood into the cell more proficiently. This means your body requires less insulin to effectively clear sugar from your blood. Less insulin in your system means your body can finally deactivate the fat storage signal and activate the fat burning signal. This shift is particularly valuable at night during your natural fasting period. The advice given here is excellent. It is essential to use a genuine cinnamon stick, not powder. Most powder available in stores is of the cassia variety. Cassia contains elevated levels of a compound called coumarin. In large, consistent doses, coumarin can be toxic to the liver. True cinnamon, often labeled Ceylon cinnamon, has very low levels of coumarin and is considerably safer for regular consumption. Place 1 stick in a cup of water, bring it to a gentle boil, and let it simmer for about 5 minutes. Remove from heat, allow it to cool slightly, and drink it warm about 40 minutes before bed. This is a safe, simple, and remarkably effective ritual for supporting metabolic equilibrium. For those with diagnosed diabetes, you must, of course, monitor your blood sugar closely and discuss this with your doctor, as it can amplify the effect of your medication. Finally, we arrive at the seventh tea on our list, dandelion. This is a plant frequently dismissed as a tenacious garden weed, but in functional medicine, it is one of the most esteemed and potent natural allies for eliminating visceral fat, precisely because it supports the single most important organ for this task, your liver. Your liver is the central processing facility for your entire body. It is a metabolic dynamo. It is responsible for metabolizing fats, neutralizing toxins, managing your hormones, and storing essential vitamins. As we age, the liver's efficiency and its capacity to regenerate can decline. It becomes more readily overburdened. The liver performs its most demanding work at night, particularly between the hours of 2 and 4 a.m. This is its dedicated deep clean cycle. During this window, it processes the fats you ingested during the day and begins to mobilize stored fat, including visceral fat, for energy. But to accomplish this, it requires one crucial instrument: bile. Bile, which is produced by the liver and stored in the gallbladder, is what emulsifies fats. You can think of it as your body's natural detergent. It breaks down large fat globules into manageable droplets so your digestive enzymes can process them and your body can eliminate them. Without sufficient, healthy, flowing bile, fats are not broken down correctly. They are recirculated and are more likely to be redeposited. Dandelion's power originates from its naturally bitter compounds. These compounds are what we term a chalagogue. They stimulate your gallbladder to contract and release a healthy flow of bile. They also function as a hepatic, meaning they support the liver's own detoxification processes, what we designate as phase 1 and phase 2 detoxification. By drinking dandelion tea before bed, you are essentially preparing your liver for its important nighttime work. You are ensuring it has the bile it requires to break down fats efficiently. The preparation is simple. Use 1 tablespoon of dried dandelion leaves or root in a cup of hot water and let it steep for about 15 minutes to fully extract those active constituents. That slightly bitter taste is the medicine. It is an indication the beneficial compounds are present. Dandelion offers an extra benefit as well. It is naturally abundant in potassium. This is important because, like hibiscus, it also has a diuretic effect, helping to reduce fluid retention. But unlike many other diuretics, it is potassium-sparing, meaning it supplies you with potassium while helping you flush excess water, making it much safer in that regard. To genuinely profit from these teas, the essential factor, as was rightly concluded, is consistency. But I must add this as your physician, these teas are not a magic solution. They are not a substitute for sound medical advice, nor are they a cure for a poor diet or an inactive lifestyle. They are supporters. They are a reinforcement system. They help to optimize your body's own natural processes. Reducing visceral fat is a gradual and steady progression. It absolutely necessitates a diet that is low in processed sugars, refined carbohydrates, and industrial seed oils. These are the foods that fuel visceral fat and drive the inflammation we are striving to combat. You must replace them with a diet rich in fiber from vegetables, high-quality protein to protect your muscle mass, and healthy, natural fats. Remaining hydrated during the day is equally critical. Your kidneys cannot flush out toxins if they are dehydrated. And as was mentioned, it is vital to avoid consuming heavy meals at least 2 to 3 hours before drinking your tea and going to sleep. Your body possesses a limited amount of energy at night. It can either concentrate on digestion or it can focus on repair. It cannot perform both tasks well simultaneously. If you go to bed on a full stomach, your body will expend the entire night working on digestion, and that complete repair and detox window, the very window we are attempting to target with these teas, is forfeited. Select 1 or 2 of these teas that appeal to you and seem suitable for your health requirements. Alternate them throughout the week. And pay close attention. Observe how your body responds. Do not merely look at the scale. Notice how your stomach feels. Notice the quality of your sleep. Notice the energy you awaken with in the morning. These are the genuine indicators of returning metabolic health. This is a natural, steady process of providing your body the support it requires to heal itself. Thank you for watching.